Perfectly usable drugs, billions of dollars in life-saving medication dumped into incinerators. The thought alone enough to make you sick. Right now, some in the valley are trying to salvage those drugs. And they tell ABC 15's Angie Cayley the system needs to change.
Life-saving medicine. You paid for it with your tax dollars, but we found it's thrown away day after day after day.
It's being shredded and destroyed. This medication has already been paid for by Medicare.
The EPA estimated in 2015 that about 740 tons of drugs are wasted by nursing homes each year throughout America. That's just nursing homes. Pharmacies and manufacturers also tossing perfectly good sealed medication too. Once it gets close to expiring, it's taken off the shelves, then eventually dumped into furnaces. Life-saving medications.
Life-saving medications.
Steve Hazlett used to be a retail pharmacist. He says there's a massive oversupply of drugs that are just never used.
Most of them are your expensive, your medications for asthma, diabetes, blood pressure, hypertension, cholesterol medications that people need on an everyday basis to survive.
And having to tell someone it's out of reach is hard.
You see just hope drain from their faces.
Fausto Lanfear knows that rejection.
The insurance I have right now, I need cover 5,000 deductible for start using my insurance.
Ironically, Lanfear's profession, he's a certified nursing assistant.
And don't cover me. And it's a lot of people in my work with the same situation I have.
Every month he goes to the Mission of Mercy mobile clinic to get his diabetes and blood pressure medication. Mission of Mercy alone hands out 30,000 medications a year, and they pay for all of it. Some of that same type of medication is what's being destroyed.
For us to be able to have a way to work with those organizations, be able to accept those medications, it would be so valuable to us. It would free up dollars for us to be able to spend those funds on serving more patients who need our help.
Some states have an established drug donation program collecting unused and unexpired meds. Arizona lawmakers passed a law allowing a similar program, but it's not operational.
You have to follow their super strict guidelines, and they make it almost impossible to get that medication that is just sitting there to the people who need it.
Hazlett also believes there needs to be more incentive to participate. It would require extra work for drug makers that are already turning multi-billion-dollar profits.
Those medications could be funneled to the clinics that dispense those medications, or pharmacies. And that's kind of where we come in. This will be where a majority of the drugs are going to go.
Hazlett is now the director for Sanrio Health, a new nonprofit pharmaceutical wholesaler with a warehouse in Tempe. But right now, the shelves are empty.
Our goal is to get medications donated to us from other wholesalers, manufacturers. The manufacturers would get a tax credit for the donation.
Sanrio Health would then supply medication to clinics like Mission of Mercy for free or at a reduced cost. That sounds like a no-brainer to me.
It does sound like a no-brainer, but the issue is that a lot of companies don't realize that this is an option.
And Hazlett believes the cure for so much unnecessary waste. Angie Cayley, ABC 15, Arizona.